everyone, Dr. David Perlmutter here. Welcome again to the Empowering Neurologist. Today we're going to focus on an area that doesn't get a lot of attention in integrative and functional medicine, and that is vision. So we're going to focus on that. We're going to be talking to Dr. Sam Berne. Dr. Berne is an optometrist in New Mexico. He's been in private practice there for more than 25 years and is really quite a leader in the area of functional medicine. He has an integrative, holistic approach to general health and really does try to look at the implications of eye health as these implications may relate to the rest of the body. He holds a Bachelor of Science from Pennsylvania State University, a Doctor of Optometry from Pennsylvania College, and did his postdoctoral work at the Giselle Institute in collaboration with Yale University. He's been the recipient of many awards, including the Special Awards for Service from the Behavioral Optometrist in Mexico for his innovative and holistic work in working with children. So let's just jump right into our interview. Welcome, Dr. Berne. I'm glad you're with us today.
Thanks. It's really nice to visit with you.
So as I had said before we went on the air, that I wanted just to jump right in and talk a little bit about what got you interested in eye health. And I think, maybe if you'd share your personal story about your issues that you went through and how that was an eye-opening experience for you.
Well, when I was about 8 years old, I had some learning disabilities, and my mom took me everywhere. And I ended up in an eye doctor's office, and I got a pair of nearsighted glasses that didn't really help my learning disorder. Every year I would go back and get a stronger prescription, and I was a memorizer. That's how I got through school. So when I graduated optometry, I actually met a holistic eye doctor, and I entered his program called Vision Therapy, which is a physical therapy for reprogramming the eyes and the brain and the body. And two things happened. First of all, after going through his program, I didn't need my nearsighted glasses anymore. So I realized I was carrying a lot of tension in my eyes. And second of all, he diagnosed me with a condition called convergence insufficiency, which meant my two eyes weren't working together. My left eye actually wandered out, and my brain suppressed the left eye. And so once that was repaired, my reading skyrocketed, my learning got really much better. And I said, wow, I really want to go into this. So that was one inspiration. And then another inspiration was I was working at one of the hospitals, and I went into the outpatient clinic where patients had traumatic brain injury. And these are folks that suffer double vision and memory problems, vestibular issues. So I began administering this physical therapy to them, and within a few months, they were back driving, they were reading, they were functioning at a high level. So this is how I built my practice, and I started working with people who weren't getting their needs met in regular eye care. So this was special needs kids, and then in terms of the elders, even way back then, I would counsel them about nutrition. And I'd say, look, eat some more carotenoids, fish oil. And in a few months, they would come back and say, Dr. Berne, my cataracts are going away. My macular degeneration is getting better. So it was all these things together that led me along this path to see the eyes as an integrated part of the whole body.
Well, it's been said the eyes are the gateway to the soul, but now we're talking about the eyes being the gateway to the health of the body. And let me just digress a moment, because you're talking about nutrition and the eyes and nutritional supplements. So can we talk about what might be the handful of key nutritional supplements that are really important for eye health?
Well, let's start with the carotenoids. I mean, there's some exciting research that's out there of the benefits of taking lutein and zeaxanthin, which our bodies can actually produce. And it's so important for macular health, lens health. So I think that we would start with the carotenoids, and that's where we get our green leafy vegetables, our spinach, our kale, our collards, our broccoli. Very important. A lot of eye disease occurs because of oxidative stress. So if we can boost our antioxidants, that's really important. And I would say one of the major antioxidants is glutathione, the master antioxidant of the body. And there have been studies out that show that people with cataracts actually have low levels of glutathione in them. So If you start supplementing with glutathione, eating rich foods with glutathione, that's another benefit. And then, of course, fish oil and the DHA are so important for optic nerve health and overall retina health. I was just reading a study about organic pasteurized eggs, that the egg yolks have a high degree of lutein and zeaxanthin. And so, these plant-based foods are so important for our eye health. And I would add one more, and that's the probiotics that you talk about. I've seen a connection between problems with inflammation in the intestinal system and macular degeneration, as an example. So we need to eat better, plant-based foods.
Let me just take that for a moment. The effects of inflammation throughout the body, and obviously in this case in the eye. But you've done some work and have talked about the fact that the eye actually has its own set of organisms, its own microbiome, if you will. And I think that might be surprising for a lot of our viewers.
So Dr. Louise Liu at Yale University just published a study where she discovered that the eye actually has its own ocular microbiome, especially in the cornea and the conjunctiva, that's the underside of the eyelid. And there was another study that came out in the Journal of Microbiology that contact lens wearers tend to have a lower ocular microbiome. And so one of the things I've been talking about is the fact that if we can boost the good bacteria in our eyes, we're going to reduce infections, things like conjunctivitis, and then the more serious eye conditions like uveitis and iritis. And then, of course, with contact lens wearers, they need to wash their hands, clean their contact lens case, not wear their contacts when they're in swimming pools or spas. And then to use eye drops that are oxygenating and hydrating, because there are eye drops out there like Visine and artificial tears that do nothing in terms of reduced inflammation in the eye. I like to use eye drops like homeopathic eye drops or MSM eye drops that actually increase cell permeability, reduce inflammation, help increase moisturization of the tears of the eye. And so, like you talk about the microbiome, there's a very important ocular microbiome in the eye, and I want to see more research, more work done in those areas.
You think it'll ever come to a point where there are actually probiotics instilled in the eyes?
I actually think so, and I think they'll be in the form of topical eye drops. I think that that's coming for sure, because there are 50 million people in the U.S. that wear contact lenses, and I see so many people that have complaints of dry eye irritation, conjunctivitis, and of course with the digital device situation, it's making the problem that much worse. So I think that's a great plan. I'd love to see that.
Let me go back to an area that we've already touched upon and just in passing, and that is cataracts. So maybe first describe what actually a cataract is, and then we can talk about that mechanism in terms of what we can do on the plus side.
Okay, so in terms of a cataract, basically it's a metabolism problem in the lens of the eye, and it's an avascular structure, which means that it's relying on its nutrients indirectly. There are no blood vessels that go directly to the lens of the eye. And in terms of cataract development, one of the reasons why people are developing cataracts is because of metabolic waste that's not able to be flushed out because of the lowered oxygenation and hydration in the overall eye area, but especially the lens of the eye. I would also say that ultraviolet radiation from the sun and the blue light that comes off of computers can also increase the risk of cataracts. So in terms of what you can do, well, first of all, there are actually some homeopathic eye drops that you can take that actually start dissolving the cataract. And then you want to really take an intensive eye vitamin with lutein, zeaxanthin, beta-carotene, vitamin D3, the trace minerals like chromium, selenium, magnesium. I would also use the MSM eye drops because they actually increase the penetration of the homeopathic eye drops. And I would use, I would also increase my diet with lots of antioxidants. I would also supplement with probiotics to reduce any inflammatory response. There are actually some studies out there that say that, if you are eating lots of carbohydrates, that your insulin levels shoot up, and this can be a causative factor for cataract formation. So there's lots of holistic things that you can do with supplements and nutrition to reverse cataracts. And let me also say, I recommended that surgery for my dad. It's a very successful surgery, but I'm an advocate for people because you have to navigate them around, the ophthalmology surgery. The ophthalmologists don't exactly say exactly what they're going to be doing. One thing is, if you're going to get cataract surgery, you want to correct both eyes for distance, because if you correct one eye for reading and one eye for distance, it actually splits the brain, and then you've got difficulties with stereopsis, depth perception. So, that's the deal around cataract.
In this category then of what I guess we would consider degenerative conditions of the eye, I think most people would assume that as we age, our eyes are going to deteriorate, and most of us have experienced that. And I think in your writings, you've kind of challenged that notion that we should all expect that our vision is going to get worse with time.
Yeah, I have so many patients in their 70s and 80s. They've been diagnosed with, let's just take age-related macular degeneration, and they get the diagnosis, and it's a pretty hopeless diagnosis. So if you start taking some nutrients and doing some eye exercises, increasing the eye circulation, wear the proper lens prescription, your eyes don't have to age in the same way that, what the doctors are saying. You can actually improve your vision as you get older. And, I've been at it 35 years, and I have thousands of people, especially the elders, who are improving their vision. And you can do it if you follow the steps and the protocols that I'm promoting.
You're really dialed in on the importance of, as you've mentioned, nutritional supplements, antioxidants, the carotenoids, trace minerals. The AREDS study is certainly something that everybody wants to quote, and even vitamin manufacturers use the results of the AREDS study in terms of formulating their products, saying this is the exact balance of supplements that was described in the AREDS study. And so I'd like to ask you two questions, just sort of what that study was all about, and beyond that, do you think it's worth pushing some of these supplements to higher levels despite the fact that the AREDS study said this is what we used?
Well, I think it was a breakthrough study, and it's hit the mainstream, and so more and more people, especially doctors, are looking at it. I'm of the school that, yes, I think you need to boost the antioxidants and you need to boost your nutritional health just based on the toxicity in our environment, the weed killer that's, causing inflammation in our gut, chlorinated water. So our intestinal system is getting slammed, as you advocate and promote, and I agree with. So I'm of the school to boost the antioxidants and vitamins and minerals. And when I do that, I actually see a more accelerated increase in improvement, and it really inspires people. I can take back my health.
Mm-hmm. Well, you're drawing this relationship then between gut health and eye health, and I can't say that's a well-known relationship as yet, but tell us more about that.
Well, we know that in fetal development, at about 9 weeks, the eyes start growing out from the fetus's brain. And so any structure of the eye, any anatomy of the eye is really just brain tissue. And we also know from your writings and many others, the gluten, the inflammation in the gut and how it affects the brain. And so the eyes are part of that. So they qualify for something called neurogenesis. And I've seen it, for a long time, that when I start applying different nutrients to our eye health, I start seeing this neurogenesis, and I've made the connection that the eyes originate from the brain. And as we reduce our inflammatory response, our absorption gets better, our hydration gets better, and, we return to health. And I think that's what I'm promoting in my practice and with my teachings.
Mm-hmm. Now, when you're talking about neurogenesis, where is that taking place?
Wow, where is it taking place? Well,
as it relates to eye health.
Yeah, I've seen it take place with people with glaucoma who are getting visual field loss. And by the way, glaucoma is, I call it the silent thief. So if you don't get a regular eye exam, a lot of times the optic nerve, because it's an eye intraocular pressure problem, what begins to happen is that the optic nerve begins to die off, and so you start to get these visual field loss, So by applying different nutrients and eye exercises, what I have measured is that the visual field actually starts to increase. And in some of the studies I've seen is that actually glaucoma is a brain problem. It's not an eye problem. In any event, whatever it is, I have seen people regenerate, through their macular issues, through the glaucoma and optic nerve issues, even cornea issues where people are having, dry eye syndrome by using agents that actually replenish the cornea. I start to see this regeneration, and their eyesight gets better, their vision gets better, and their cognitive skills get better. There was a study that was done by Dr. Mary Hain, where she took a group of patients who had retinopathy, diabetic retinopathy, and hypertensive retinopathy, and she gave these people cognitive tests. And she found that people with retinopathy scored lower on these cognitive tests. So the results showed that if there are vascular problems in the eyes, there could be vascular problems in the brain, and this could affect our cognitive memory and those kinds of things.
You have, so that would be a kind of a correlative interpretation of those results. You have talked a lot about blue light that we're getting day in and day out from our computers and other devices. What's the dealio with blue light? Why is it so damaging for us in terms of the spectrum of light that we see?
Well, in the macula, in the center part of the macula, we have a yellow pigment called zeaxanthin. And this is like wearing a pair of sunglasses. So it deflects the blue-white light that comes off these digital devices. And what the studies show is that, if you're not getting enough lutein and zeaxanthin, especially zeaxanthin, that you're opening yourself to macular degeneration. Now, it's interesting, a trend that I've seen in my practice is that people who get cataract surgery, if they don't get the blue blocking lenses in those intraocular lenses, a year later they're coming back and they're having macular problems, macular degeneration. So in the studies, blue-white light is damaging to the retina, especially the macula. There are also other studies out that show that when you're using the digital devices after 6 or 7 p.m. at night, you're going to be suppressing melatonin, so it affects the sleep cycles, and that's pretty well known. Where it's not well known is folks that have had cataract surgery and they're still using their digital devices. They're very susceptible to getting macular degeneration. So my recommendation is they have to get these blue blocking lenses. They're yellow tinted glasses, and that will protect your eyes from the deterioration that happens from the blue-white light.
Mm-hmm. Let me go back, if I could, because I know this is going to resonate with a lot of our viewers, and talk about contact lenses. I kind of got the sense in talking to you, or here listening to you a few moments ago, that you're not necessarily totally in favor of contact lenses. Can you tell us why that would be?
Okay, so first of all, any lens prescription you get from the eye doctor, if it's based on the 20/20 reading of the eye chart, and 20/20 means I see a 1/3 inch letter at 20 feet, that prescription is actually going to weaken your eyes, no doubt about it. And a lot of prescriptions that I will prescribe as a second prescription is a weaker prescription, and that actually is more relaxing for your nervous system, for your neuromuscular system, and over time, your eyes will actually relax into the weaker prescription. The thing with contact lenses is that, number one, the studies have shown that it does reduce your ocular microbiome, so you're more susceptible to infection and inflammation. Number two, I think with contact lenses, it can create more dry eye, especially if you sleep in the contacts or you don't handle them, with good hygiene. And number three, I think it's really good to take your lenses out when you're in a zero demand visual situation to let your eyes rest and relax. Because, wearing a lens all the time is like wearing a brace. It's going to weaken your eyes. And of course, that connection of the eye-brain, it's going to affect your perception, your movement, your posture, your balance. So the idea is you can wear contacts. You wear them for sports, you wear them for social, but you have to be selective in the optical system that you use, and you need to give your eyes a break. That's my philosophy.
So it's not good enough just to take your contact lenses out at night when you're sleeping, but I think what I hear you saying is to take your contact lenses out and use your eyes as well, because otherwise that might weaken your eyes, because your eyes sort of become dependent upon the value of the contact lens versus lens adjustment on its own.
It makes you very unconscious with your eyes to wear the contacts all the time. And the other piece is that, you know, the measurement is based on the distance reading. A lot of people will use those contacts for computer or reading. That's a much too strong prescription, so it's going to accelerate presbyopia, which is the need for reading glasses. And the other thing is that, you know, with the contacts, if you've got a lot of tension in your eyes, it is going to contribute to eye disease because there's less circulation, there's less lymph, it lowers the immune system, it creates more inflammation, you're more susceptible to infections. You know, so for me, I like to have variety in the lenses I use based on what I'm doing. So if you're driving or you're traveling to the airport and you need to see the signs, you wear your distance contact lenses. But if you're at home in your bedroom, take them out and let your eyes just be in that natural state. That's going to be very relaxing for your nervous system.
Well, let me take it a little bit further. And what about corrective surgery then, like LASIK, those procedures? I mean, you know, there's obviously no going back. What are your thoughts there?
Well, my thoughts are that, you know, when we develop a certain refractive error, nearsightedness, farsightedness, astigmatism, number one, it's not just genetics. Number two, it's really environmental, how we use our eyes that's going to create a certain refractive error. And in terms of that kind of prescription, if we start wearing it, it's going to lock our eyes into a certain place. Okay, so we want to blame faulty vision on a deteriorating eyeball, but it's not the eyeball's fault. It's the programming behind the eye. So it could be our posture, our movement, you know, our diet. When you get LASIK surgery, you are changing the optics of the eyeball, but you have done nothing to influence the programming behind the eyes. So what ends up happening is you get the surgery, and within a year or 2 or 3, guess what? Your prescription starts to return to the eyeball. And then you end up needing corrective lenses again. But on a physiology level, when you do LASIK surgery, you're going to be more susceptible to dry eye, inflammation, glare. It's not a good way to go. I mean, it's a quick fix, but I mean, seeing it over the years, it just opens up a can of worms for people. If you can work organically, like what I did, to re-educate your eyes and your brain, I think it's a better way to go. And I know this is controversial with some of my colleagues who do LASIK surgery. It's just my point of view.
And that's why we do these programs, because we love alternative ideas. So what can our viewers do to learn more from you?
What you can do is go to my website, drsamberne.com, or my Facebook page, Dr. Sam Berne. Got podcasts, videos, love interacting with folks. I'm having a really good time with that. And I want to thank you for having me on. It's been great to visit with you.
Great. I've enjoyed it as well. And again, hopefully for our viewers, those websites and a Facebook site appeared on the bottom of our screen by magic. And Sam, it's great to talk to you. All the best, and thanks for joining us today.
Thank you, David. Take care.
Bye for now.
Bye-bye.
Well, again, thanks to Dr. Berne for joining us today. Really interesting information. I hate to say it, but I'm going to say it. A real eye-opening interview, having lots of implications, not just for the eyes, but for the brain as well. So I hope you enjoyed this information, and thank you for joining us. I'm Dr. David Perlmutter.